I'm a dentist. I practice holistic, reconstructive, and biomimetic dentistry in Encino, California. Biomimetic is just a fancy word, which comes from bio, meaning life, and mimetic means copying. So it's how we rebuild teeth rather than tear them down. And it sort of will be the wave of the future. It's not there yet, but as a holistic pioneer back in the late 90s, early 2000, et cetera, out here in Southern California, I saw a similar trajectory and parallel. Because back in the day, that was, oh, you do that kind of thing. That's, frowned upon, and, it's kind of quackery or things like that, right? But it was all backed by science. Well, now fast forward over the years, now holistic dentistry is much more accepted in mainstream. It's even more accepted with traditional dentists. Like, okay, it's not frowned upon as some weird, strange practice. And then Biomimetic started coming along actually in the late 90s, early 2000s, and it is further based on completely scientific literature that backs up how do we reconstruct and rebuild the tooth from the inside out, let's say, after it's been broken down by severe tooth decay or trauma, et cetera. And that's all based on the science. So everything I've done has been based on the scientific literature, not just some cool opinion in the hallowed halls of having a poker party somewhere with a bunch of other dentists, let's say. So anyway, I've enjoyed that for many, many years, and helped a lot of people along that way. And the whole idea is we want to actually help preserve teeth now rather than tear them down. We had the history of doing crowns on teeth, rubbing them, grinding them down, destroying 75 to 80% of the enamel structure in doing that. Well, that was a tool that we had. It's still a big tool for traditional dentistry, which is fine. But there's better ways to rebuild the teeth. We can keep more tooth structure. People are living longer, for example. And some of this was interesting. Years ago, I was talking to a surgeon who does hip replacements and things like that. He said, we first started doing hip surgery. We learned a lot about the accuracy of placing hip implants and placements and things like that from dentistry, the digital aspect of dentistry. So dentistry a lot of times leads the way in innovative ideas where other medical sciences further improve along that line. But he said, back in the day, we would wait till a person was in their 70s before we would replace their hip because they wouldn't last that long. And, they would generally pass away before it became a problem. So now they've figured out a way to do it better, less invasively, that will last a lot longer because people are living longer. So it's the same way with dentistry and people's teeth. How can we rebuild them in such a way that we protect the precious nerve inside the tooth so that if the tooth breaks down again, they're not going to lose the whole tooth or end up needing the gray area of gray areas in holistic field of dentistry, which is root canals. Mm-hmm. How do we avoid those things? And biomimetic dentistry and reconstructive dentistry using biomimetic and holistic principles seems to be the answer to that. Just in my practice alone, for example, years ago when I was doing traditional dentistry, I would have to do maybe every day or every couple of days, someone would come in because they had pain or discomfort from a procedure that had deep decay, et cetera. And it's been no big deal. I'd send them across the street. They'd go get a root canal and they're out of pain. That was 1 or 2 or 30 or 40 or so a month. Now doing biomimetic dentistry, it's a handful, maybe 8 or 10 a year that have to go through that type of procedure if necessary. So we know how to rebuild the teeth. We know how much flexation a tooth has internally, how the hardness works, because we have these separate structures built harmoniously within the tooth. We have the outer hard enamel, and then we have the inner material, which is called dentin, which just means in tooth. And then that all protects the precious nerve, which is like a mini brain for the tooth. It's kind of like a football football player's helmet. So they have the hard outer helmet, the soft spongy on the inside, and then of course you have the skull and the brain there, right? So the tooth structure is built in a similar way to withstand a lot of forces and a lot of pressures. So along the way, that's what we were doing now. That's what I've been doing as far as rebuilding and reconstructing teeth. And I love it because I'm more of a sculptor and an artist working with my patients, and they're appreciative too, once they understand the concept. But then I thought 20 years ago, I was looking at also, well, what can I do to prevent there from being all this severe suffering on the planet? I mean, think about 50% of the people on this planet have, as we're talking, severe gum disease and or tooth decay that they're suffering from. And I thought, gosh, we can send people into outer space now. We have all this technology, but people are still suffering with all of this. What's going on? Are they just not brushing? Are they just not cleaning? And it's sort of a multifaceted thing where it has a lot to do with the change in nutrition, the high consumption of grains and processed foods, processed sugars, and things like that contribute to this whole debacle. But, you know, years and years ago, before there was even refined sugar in our society, grains, you know, people ate more of the paleo type diet, let's say, or they ate the foods from the land, and they survived quite well. And fossil studies show that they had very little gum disease and very little or no tooth decay. In fact, the kings and the queens of England suffered with tooth decay because they could get their hands on honey and sweet items and things like that. The regular workers around the castles, etc., they had good health. They just had poor conditions, living conditions. So I started looking at, well, what can I do? So I formed a company called Great Oral Health for the listeners and followers and viewers of the show. They can look at the name of the company is Great Oral Health, and they can go to greatoralhealth.com. And I have a free ebook that's there all about some of the history of dental situations, the history of dentistry, and also how people can take care of their teeth. And then along the way, I started looking at some of the holistic and natural tooth products that were out there, toothpaste, mouthwash, cleansing agents, etc. And I thought, gosh, the ingredients are not really that wholesome. They're not really that great. What can I do? So my daughter and I in our kitchen, we started playing around with stuff. This is about 15, 16, 17 years ago, mixing ingredients and playing with things. Anyway, from there spawned the concepts of the Great Oral Health company, which I founded and formed. And then we also built in several of our patented products that are all natural. They're fluoride free, but they have ingredients that will actually help people prevent tooth decay from coming in. And so we have a three-pronged attack with that company. It's basically, we want to get rid of the bad bacteria that form, because most tooth decay and gum disease comes from a dysbiosis, or the bacteria are unbalanced in the mouth. And what we saw is that if we could balance that, people could come into health the same way that they're trying to balance the gut and trying to balance some of those types of things. And what we found is that I put together a 7-strain probiotic specific for the ear, nose, throat, and mouth. And it was a help to bring about a certain balance, because 2% of our population just doesn't get tooth decay or gum disease. Very lucky people. But we were able to isolate what are the main bacteria that they have in high amounts. And it's a certain type of bacteria. And that's been now isolated. So we're able to capture those and actually can grow those types of beneficial bacteria and provide those to the regular public. So hopefully it can convert us 98%ers to the 2%ers as far as having a natural type of microbiome in the oral cavity. And then funnily enough, we found that in using that, it decreased the amount of tooth decay. It decreases the amount of ear, nose, and throat infections and recurrence in children. So a lot of side benefits that started happening when we started balancing that out. So it's out with we want to go out with the bad bacteria. We have certain ingredients in an essential oil and toothpaste that takes care of that and eliminates all this harmful bacteria naturally. The toothpaste is glycerin free. There's no sodium lauryl sulfate in it. There's no fluoride, etc. But there are beneficial ingredients like high concentration of aloe, xylitol, etc. to help a person heal their teeth and gums. But at the same time, that was to bring down the bacteria, remineralize the teeth. But then what can we do about rebalancing the bacteria? So that's where the probiotic came in. And so it's sort of a three-pronged attack, because I think we've seen it in medicine, we've seen it in dentistry, and a lot of the allopathic healthcare fields. We're great at cutting it out, burning it out, getting rid of some inflammation, et cetera, but we just haven't figured out a way to restore balance. So the great oral health companies pushing to help people, to empower them to learn how to care for their teeth themselves, how to do proper brushing, proper flossing, and then what different ingredients they can use to help bring their mouth into a stable state. With one caveat: if you have tooth decay, if you have gum disease, et cetera, you do want to work with your dentist to get that under control. But this will help it from worsening. This will help it from coming back with stability. So those are some of the things that I've been working on for the last number of years, joyfully, with some success.
Great. Thank you very much for that explanation. What are some other examples besides the crown and doing that differently? And what do you do as an alternative to grinding the tooth down and putting a crown on it? But what are some other differences in the biomimetic dentistry as opposed to the more barbaric, as you call it, traditional forms of dentistry?
And it's looking at an individual holistically, and if there's a way to rebuild the teeth with some gentleness and some predictability, we want to do it. And we found that there is a way, and biomimetic dentistry can do it. So what exactly do we do with biomimetic dentistry? I mean, I have a whole video series that explains that. Anybody care to go to it? It's just called freeholisticdentalcourse.com. And it walks a person through from A to Z, from the anatomy of the tooth, the anatomy of the jawbone around a tooth, how it functions, its purpose, and all these kind of things. And then I show examples, and I show the difference between cutting down a tooth for a crown, or now what do we do if we're not going to do a crown? Well, typically the tooth breaks down with tooth decay, or they might even have a crack. But rather than grind a whole entire tooth away, we can sometimes go in, find where the crack is, go down and mend the crack by bonding it together. And then over the top of the surface of the tooth, the chewing surface of the tooth, we can lay what's called an onlay. It's a porcelain piece of material that lays on, that's why they call it onlay, on the top of the chewing surface. So it's sort of like a sandwich technique. We build the tooth up with many, many layers of a very compatible bonding that also flexes at the same rate of flexation that we have from the inner part of the tooth. Finding those materials and using those is a game changer, because you have greater predictability of long-term success. So if someone comes in, they have tooth decay, we're able to remove it carefully. We even use certain stains to make sure we're not taking too much tooth away, or that on the opposite side, we're not leaving tooth decay behind, because there's certain areas where we don't want to leave tooth decay behind. It will continue to spread, and more on that in just a minute. But then we build the tooth up, and the reason we do it in layers, it was discovered if you do a little bit of bonding at a time, as you put, most people that'll be watching this, they've had a filling done, et cetera. So that if they're doing a white filling, the dentist goes in, drills, and he sticks something in there and puts a blue light on it. And you hear a beep, 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 beep. Okay, polishes up and he's done. Well, if you put it in as one glob, it shrinks. They all shrink anywhere from maybe 1.25% to as much as 5 or 6%. As they shrink, they pull on the tooth, which can stress the tooth internally, or they can debond over time. So we don't want either of those to happen. So by doing small layers, curing it, another small layer, curing it, we decrease the amount of stress that's placed on a person's tooth, because ultimately we want the tooth to mimic as close as we can to Mother Nature.
Great,
I
thank
hope
you.
that explains I hope that answers your question.
Yeah, it absolutely does. It absolutely does. So, we had a speaker on yesterday, or a couple of days ago, Dr. Michelle Jorgensen, and she was talking about infections in the mouth. Like if you had a root canal, you most likely have an infection still in your mouth. There's gaps in there, as well as wisdom teeth. A lot of times it's not done right, and there's these infections that can cause havoc throughout the body. What are your thoughts on that? Is that part of stuff that you do? Do you see that people have these underlying infections with some of these, I guess, procedures that you're trying to avoid with
Right.
Biomimetic? That's how you say it, Biomimetic Dentistry?
Yeah, Biomimetic.
Biomimetic.
Yeah. Well, biomimetic dentistry is more the dental engineering aspect of rebuilding teeth. It's not the same as biologic dentistry or holistic dentistry. So they're separated out. However, they should almost be merged, because as a holistic dentist, you want to prevent root canals. Because root canals, as I mentioned earlier, and I said I'll talk about it some more, is a gray area. And I did mention also, I'll talk a little bit more about, we can go in where there's deep decay. If the tooth is still alive, we can leave decay now, and the body will heal itself. But we have to remove decay in a certain area, a certain specific way. And if we do that and leave a little bit of the decay behind without going into the nerve, we prevent root canals. It's a big paradigm shift. Most dentists were taught, oh, well, that cavity's deep. You might as well get a root canal now because you'll probably need one later. Like no connection between a root canal and overall body symptomology down the line, or weird systemic effects. But going back to your question, when a person receives a root canal, it's very technique sensitive. So it depends who's doing the root canal and what kind of procedure they're using. Without an illustration here, it's sometimes a little bit hard to explain. But I do go over that a little bit on the freeholisticdentalcourse.com. I lightly touch upon it. But you can imagine a root canal itself, down inside the root of the tooth is a nerve, there's a vein, and there's a red blood vessel, right? There's a small little capillary. So they're in a triplet. That's how things kind of usually move throughout the body. You usually have a vein, an artery, and a nerve following the same pathway. So as a tooth is developing as a little bud, it needs a blood supply to keep the nourishments coming in. And then once it fully erupts and comes in, the blood supply remains intact, and that's the nerve inside the tooth and the pulp, and it keeps the tooth hydrated, which is nice. Every pumping of the heart, it floods up through there. And what people don't know is that there's little tiny tubules going from the nerve outward all the way to the root system and all the way up near the enamel of the tooth. They're called tubules. And they're filled with some of this solution, inorganic and organic type, mostly organic type solution in there. And what happens is that by this nice hydration, there's a pulsation. When a tooth gets severe tooth decay, if the bacteria can invade far enough and contaminate and inflame the nerve gets inflamed. Well, it's the same way if the brain gets inflamed, the doctors have to go in and they have to open part of the skull and get it to drain out so it doesn't choke itself off. So what happens inside a tooth? It strangles itself by the inflammation. And then all of a sudden, a person says, oh, I have a toothache because there's such pressure there. And it can be excruciating to minor dull ache. Everybody's different how they respond. So the treatment of choice has been around for about 100 years or so, to go in open the tooth a little bit and take that little spaghetti string of material out of there, which is the nerve and the little artery and the little vein. It's all one piece, and they scoop it out. And the way that they scoop it out is with little files. And now we use an X-ray to measure it. And by measuring it, then we know where the length of it is down near the root. We want to seal it as close to the end as we can. But that was looking at it strictly from a larger viewpoint with an X-ray, and not realizing the anatomy of the tooth has all these tubules. So we could clean the big canal out, put some sterilizing materials down in there. But then after we did that, what would happen? Well, it appeared that some of the bacteria still migrated and hid in those little dental tubules. And they would then mutate into a more harmful type of anaerobic, which would be non-oxygen breathing bacteria, and it mutates and it becomes a problem. What's the problem? Well, it can create latent infection, it can create hidden infection, or there can be toxins that you can measure under there. Where do those toxins go? Well, they go into the bloodstream. Does it affect a person? It might. And the truth is, some say, yes, it does 100%. Others say, no, it doesn't. The science is still a little bit in the middle on it. We can show blood tests and show that there's range differences in people that have had the root canals, especially if there might be some infection there. And there used to be a test where we could take a sample down along the side of the tooth and have it cultured to see what possibly could be brewing around that tooth. Well, what was discovered by a chemist, Dr. Boyd Haley, out of University of, I think he's up in Kentucky. He's a professor emeritus, and he had this company where you could sample what kind of toxins were coming out of there. He sold the company, and sadly, they went out of business. So it's not available at the moment. But he represented a lot of dentists that pulled people's root canal teeth, and he said every single one had toxic sludge and bacteria around them. So I asked him, I said, well, Boyd, what should we do? Does that mean we should pull every single root canal out there? I mean, he said, no, I don't think that's the answer either. And we both kind of came up with the same thought, that it's somewhere, it would be nice if we had a systemic test to see if someone's being negatively affected by that, or someone could be negatively affected by that. And some people could, like if their immune system's crashed or things like that. As a holistic dentist, we have to look at them and go, okay, is this going to be a viable treatment for them, or could it crash their immune system more? So we just don't have a perfect way of going, okay, this one's infected and your body can't handle that load. Because some people, they can have infection, they can have stuff going on, and they're living pretty happy into their 80s and early 90s. And then there's other people, like I had a 18-year-old patient. She had chronic fatigue. She got sick, couldn't get out of bed for 3 or 4 months. When she finally did get the energy to come in, she had some infected molars and a couple of wisdom teeth as well. Now, normally I'd say take the wisdom teeth out, and maybe the others we could rebuild, and maybe she could get a more holistic type of root canal. In her case, I said, nope, let's get them all out because they're just so badly infected, and let's see. So we did, and within 2 or 3 months, she had a full recovery. Well, that's miraculous, and we love it. It's not always the case. And so the big message I would have for people watching the show is that, many of the symptoms that go on with our bodies, many of the things that go on, it's not just from one thing. It's generally multifaceted. This may be a contributing factor. So you have to go through your list, like, okay, is there infection? Should have that evaluated. You can have a CT scan done. We can see if there's infection around old root canal teeth, old extractions. Are there little areas where the bone didn't heal in fully? We call them cavitations, where they have to be opened up and cleaned out. But is that the thing that's causing some maybe mysterious illness? We don't know. So the person has to go, okay, it's part of their journey. They go in, they get things done. I don't even know if it's above the placebo effect, 22% or 18%, that actually feel better. But most have done the research and they go, you know what? I got that toxic sludge in there. I got something showing up. I'm just going to get it cleaned out as a preventative thing. I think that's really wise. I would always advise that if it's not harmful, if the little cavitation is not near a major nerve or anything like that, it seems to make sense. So there's a lot of things for people to sort of weigh and look at. Now, if a person does decide they're going to have a root canal, there's a couple of procedures they can look at. One is called the gentle wave root canal procedure. And that's just a machine that, rather than packing a file down on that in that nerve and maybe pushing debris laterally, which blocks the dental tubules and blocks bacteria in there, this is more like a vacuum, and it suctions it out, cleans it out so that the dental tubules are completely open. Then they can use their sterilization agents to kill any bacteria living in the surrounding area from the main canals outward. The question still remains, I don't know if on the outside of the tooth, if the bacteria can get in from the outside through those dental tubules, because there's no way to fully seal all those little hundreds of thousands of dental tubules in there. They're so minute and they're so tiny. You would have to, anything pushing through there would crack the tooth. It's too much force. So we don't know. Now, there's also a laser by BioLase, which has a lateral laser, so they can place it down in the root canal and they can do the laser procedure. That seems to show good scientific studies with it penetrating deep enough along the sides of the teeth to prevent the bacteria from surviving at that moment in time. So there's different things. People have to do some of their own research because we're still learning on this, and it wouldn't be fair as a member of the International Academy of Oral Medicine and Toxicology. Even we don't say, get your root canals removed. We don't have enough science to know that with certainty. But if you can prevent them and find someone doing biomimetic and holistic dentistry, for sure biomimetic dentistry, you want to try to do that, because of ending up needing root canals can throw you into a gray zone that becomes weirdly murky.
Okay, thank you. So you mentioned dental cavitations. Is that the same as a cavity? Is that what most people would call a cavity, or is that?
No, it's just, I don't know why they just call it dental cavitation. So it's actually stuff going down in the jawbone that can show an infection that was there, and it healed over with some scar tissue maybe, but there's some maybe some toxic sludge in there. Sometimes it has heavy metals in it. It's like almost as if when it was healing and going into its final closure, et cetera, it's pulling everything in, sort of like I don't know, like a black hole or something, And so, but the majority of the time when it's cleaned out, it has junk in it. So a good surgeon or dentist, they can clean that out. They'll clean it out and flush it out. And they'll also use either ozone or PRP or things like that to help the body to rebuild it and flush it out. Because mechanically we can remove it, but microscopically you can't get all of the, let's say, infected areas or broken down cellular structure unless you start taking away too much bone. And that's would be contraindicated because you start running out of bone. It's not good.
And you also mentioned CT scans. Are things like cone, I don't know if you use the cone beam CT scan.
Cone beam, yeah.
And then like X-rays, are they something that people should be concerned about as far as the radiation, or are they safe?
I'm not an expert in that because in my office, I don't do the cone beams. I have a couple surgeons that do all the work for me, but my understanding is that they're all digital. So because they're digital, they're 70% less standard radiation types of X-rays that were done 10, 12, 15, 18 years ago. So it's relatively fast and easy. And one of the remedies that patients can take afterwards too is they can take some niacin, not niacinamide, but niacin for a few days afterwards, and they'll get that sunburn flush from it. But apparently it helps push out radiation and sun damage and things like that. Do it for 3 or 4 days. You don't want to do it long term because it'll start depleting other B vitamins. But niacin seems to be somewhat of a remedy. Some have said some things about, I think calcium helps with it too. I don't know. I'd have to do more research on that. But I know that niacin seems to flush it out a bit.
And does biomimetics go into beyond dentistry into orthodontics at all? Is that something that that they're trying to do in that field as well?
I think it's a buzzword. Biomimetic now is becoming a little bit more of a buzzword. So, people are starting to use, it's biomimetic or something like that. So I don't know. I guess there could be a way to do orthodontics that's even more conservative, but orthodontics in and of itself is quite a conservative field of dentistry. Think about it. They're just repositioning, moving teeth, expanding archways to create better airways. So it's a pretty naturally biomimetic alteration that's taking place. So, but sometimes I hear, these are biomimetic implants or something. I'm like, how do you make a biomimetic implant? I don't know. I mean, the only way I know would be it would have to we'd have to clone and regrow someone's tooth, and we'd implant it back in there complete with the nerve, right? Right now, all we can do is if someone loses a tooth in the front, we can take a middle tooth in the back, take it out, do a root canal on it, implant it in the front. And then after it takes there, we can reshape it a little bit and place a veneer on it because the root systems are similar. Well, that's cool, but then you end up with a root canal in the mouth. So how biomimetic is that? Once a person needs a root canal, the biomimetic aspect of the tooth kind of goes down because it's no longer like a natural tooth. It's lost its whole pumping and hydration station.
So given that the biomimetic term has become a little bit of a buzzword, how does somebody know that they're going to an authentic biomimetic dentist like yourself?
Now, that's a really good question. So they have to check the credentials out, kick the tire a little bit. And then there's an academy, the Academy of Biomimetic Dentistry, AOBMD.com or .org. And I've been on the board there for a long time and helped develop the protocols for the dentists who join, that they have to show where their level of training is, how much they've done, and they can get they can study all the way up to becoming a fellow in the academy. So generally, if they're a fellow, based on the protocols that I and the past president put together, if they pass through that oral examination, then we know they can actually do biomimetic from basic to advanced procedures. The thing that we don't know for sure is, do they do it routinely? Is that the way they always do it? Now, one clue would be if you call an office that says they're biomimetic, and then they say they also do crowns, you can query them on that because, you do crowns like pretty routinely, or is it just to replace crowns? Because the only crowns that I do are replacing old crowns. I've probably had to do 3 crowns in the last 5 years, just because the tooth was so broken, so decayed, there's nothing left you just have to build something from the gum straight upward. But generally, I build it up with the composite material. It takes about an hour to hour and a half. And then what we put over it is a combination. So I'm not just sticking some hard thing over the tooth, which will break down too easily. So they can ask them, does your office do crowns? Good. Is it just replacing crowns? Oh, no, we do crowns. That's kind of good. How good are you guys at crowns? Oh, that's generally what we do all the time. You know that they're not truly fully biomimetic. One of the listeners following the program here, they could also ask, how do you do your fillings? Are they done in layers? How many layers does the doctor use when he's rebuilding a tooth, right? Because we're proud of it. In Biomimetic, we know sometimes I'll finish with a patient say, wow, we did really good there. We put about 18 layers in there. It's a lot. and it is time consuming. If they're a high insurance practice where they only see just insurance patients, et cetera, you really want to check that out, because they may not have the time to do biomimetic procedures. Nothing against the insurance driven practice and things like that, right? It's just that the volume can get such that they can't spend the time they need. So another question they could ask is, how long does it usually take to do one of your fillings? And then they say, oh, it's about 15 to 20 minutes. Then you could almost assume they're not doing biomimetic dentistry. So those are just some parameters, because it is true. Sometimes someone will take a weekend seminar and then they advertise and broadcast very loudly that they're a biomimetic dentist. It would be more appropriate if they said they're learning biomimetic and trying to do the best they can with it, And when people watch my videos from the freeholisticdentalcourse.com, they'll see my approach is never to strengthen our position as biomimetic dentists by demeaning the traditional general dentists, because they're all working as hard as they can and trying to figure things out and trying to take care of their patients the best they can. Even the holistic doctors. Well, what happens is change is kind of hard for everybody and anybody out there. So, they'd have to change their protocol, have to change some of their steps, and it can be time consuming at first, and they can have failures at first if they do it improperly. So it's a paradigm shift, but once they learn some of the protocols and courses and really immerse themselves, it's a game changer for the dentist. It's so much more joyful because we're conserving tooth structure, working with people that want that and appreciate it, and we're not just like a drill, fill, and bill type of dental practice. It's just becomes more customized and joyful with our patients as well.
So for people who've had traditional fillings done, does biomimetics, does a biomimetic dentist look to replace any of that with a biomimetic filling with the various layers, or do they leave well enough alone? And is there a problem with the existing fillings that we have?
Well, I evaluate them, and I look to see is there stress or strain on the teeth, and then I look at the X-ray to see how sealed do they look, and then I visually look all around to see, are they leaking at all? How are they doing? And then make the call from that point. If they're doing well, they've been there for a while, there's no symptoms, there's no trouble, the bite is good, everything's good. Personally, I leave them alone. And I can maybe put in my computer, let's watch these. I don't think they're biomimetic, but on occasion, even with the great bonding materials we have now, it'll hold the tooth together and bond. The real problem is this, though. If the dentists are globbing them in as one piece, I like to say like a piece of Play-Doh, they just jam it in there and put the blue light on. If it's fairly deep, almost always it's going to put stress on the tooth, or it will debond. If it debonds, you'll have you'll have micro leakage under it, which means to the bacteria, it looks like the Grand Canyon. They're like, hey guys, come on over here. We got a good place to hide, right? So they're running down there and doing their thing. It can cause recurrent decay. But even in those, I might say, this looks like it's leaking. If it's real small, I might leave it alone. If it's big, like it's leaking, it's a camouflaged restoration here. It appears that it would hold your tooth together, but it's really not. We should consider redoing that. That's part of my evaluation on it. Of course, if there's any kind of decay or anything like that, obviously it's a no-brainer. We have to replace it.
Okay, thank you very much.
But you have a good question there, because I'll have patients that come in and say, I want to get all my fillings replaced with biomimetic. And, they come in, I look at them and say, well, we can watch this one and this one and this one and this one. They seem to be doing okay at the moment.
And what about just regular run-of-the-mill problems like people who grind their teeth? How does a biomimetic dentist deal with the damage and maybe helping prevent them from doing so?
Well, it's I got this from Dr. John Coyce and Frank Spears out of Washington. They used to have a practice together, and they lectured a lot together. Now they lecture individually, but There's three reasons besides an accident that people lose their teeth. And one is from gum disease, the other is from cavities, and the other is from a bad bite. Let's say clenching, bruxism, rubbing, whatever words that you want to use. If a person has this heavy clenching, rubbing, bruxism, nighttime grinding, the dentist can see it. We can see the wear patterns on the teeth. We can see if a person's rubbing their front teeth. We can put them together like a puzzle piece and show the patient. If the dentist takes the time, go, look, this is how you rub your teeth. Some people come in and they go, I'm not grinding my teeth. I don't rub my teeth. And go, well, something's wearing those teeth down. This is what you do at night. And sometimes I've had them go way out to the right side. And it fits perfect where they're wearing it. And they're going, what? I said, that's your habit. And you're deep asleep when you're doing that. That's why you're not aware of it. And so what do we do in those individuals? Biomimetically, if the wear is severe, then you have to restore those, but we would restore those. Like we're talking about if they wore all the way through their enamel, which I have quite a few, many patients that have come to see me. They've destroyed their teeth from this rubbing. Best would be to catch them 20 years earlier and have them wear a nice night guard. If they can't wear it, try to make another one. Try to make it on the top. Try to make it on the bottom. Try to figure out a way to get them to wear it. Because if they don't wear it within 20 to 30 years, there's a good chance they're going to need their whole mouth done. Well, if they have to get their whole mouth done, then at least we want to do it biomimetically. How do we do that? We open the bite, very little, create space, and then we can lay porcelain over the chewing surface of the teeth. Also put bonding in on the surface of the teeth, composite to make that sandwich technique so that it's mimicking Mother Nature. And then we're not grinding down the teeth. For example, I had a young boy that came in from Arizona and he'd been all over the country and everybody wanted to do crowns on all of his teeth. He had severe discoloration and some wear problems, etc. And I said, so he flew out, or I said, no, we can open your bite a little bit and we can restore everything with very, very minimal preparation of your teeth. He's 27, 20 or 30 years from now, he may have to replace some of those. And we want to make sure that he's got 90% of his tooth left instead of 90% gone. Also, it's about a 33% chance of root canal when a person gets a traditional crown. So they could have a tooth, no symptoms, et cetera. They have about a 33% chance over a 10-year period that they may need a root canal in that tooth. So why do it? Why not keep as much tooth structure as you can? And if the dentists are out there watching this, just go to the Academy of Biomimetic Dentistry. There's information there. You can reach out to me. There's courses people can learn and do. You don't have to be so aggressive anymore with our dental treatment. And even if a lot of these crowns are done beautifully too, and they can still last a long time, but generally speaking, we don't have to do that. And so going back to the grinding person or a person that grinds, biomimetically, the best thing to do is get them in a night guard of some type, maybe adjust their bite slightly so they're not harming it during the day. All with minimal concepts of any type of adjustment would be maybe included. If they have severe destruction of the teeth, then you have to look at how do we rebuild those teeth without having to do crowns. And that would be with very ultra thin onlays or ultra thin veneers. And I show a lot of cases like that on my website. It's just drpaulo'malley.com.
drpaulo'malley.com. Okay, great. And yeah, you got a few websites here. Okay. So
sure. Yeah.
So I'm going to ask you some procedure questions as far as
Sure.
the problems like, you mentioned
Sure.
Removing wisdom teeth. So
Yeah.
do biomimetic dentists do something different? Do they try to avoid the wisdom teeth when traditional, or pulling them when traditional dentists would, more readily pull them? Is there a different procedure that they use, or do they pull them and they, and that tends to be the same?
I mean, when you start go to extractions and things like that, you're outside of the field of biomimetic. You'd be more in the field of holistic or biological dentistry. So you'd look at what's the overall effect of this person's body, not just, oh, you have wisdom teeth, let's take them out. You have to look at, is there room for them to grow in? If they grow in, can they be taken care of? If they grow sideways, will they hurt the other good teeth? So there's an evaluation that takes place. So it's not just robotic, oh, you have wisdom teeth, go get them out. That's not necessarily the case. If there's room for the wisdom teeth to come in and grow without causing increased pressure and crowding, well, why not go for it? It's fine,
And then you mentioned root canals, you mentioned crowns. What about the implants? Is that something that you wouldn't do in that would be outside of the scope of biomimetic dentistry, or is that something that you guys need to do?
It is outside of the scope of biomimetic dentistry, but I'll make mention of a couple things. It's basically, as dentists, we should also wear our hat, so to speak, as dental engineers. So that means, what materials are we using? Harder is not always better. So a lot of dentists listening, they might disagree with me on this, but zirconium crowns, not implants, zirconium crowns are very popular now because they're so hard. I mean, it's really hard to chip or break one. So that solves a lot of problems in the dental practice because they don't have a tooth breaking here or there. The problem is they wouldn't fall into the same pattern of being biomimetic because they're too hard. They're very hard on the substructure of the tooth because of the shock value, and also against the opposing tooth. So what's going to be the long-term effect? We don't have studies out on that yet. I'm just using common sense and thinking it could be harmful long-term. Number two, on an x-ray, you can't see through a zirconia crown. So there's more natural porcelains that can be used where the x-ray sees through them, and we can see the substructure of the tooth. We can see if there's a problem or anything breaking down. With the zirconium ones, you can't. So now, if you put a zirconium one over a implant, it can be titanium implant or zirconium implant. You're going to put a very, very hard structure over a dental implant, and it may, over time, cause the breakdown of that implant. I don't know. There's not any studies out on that. I'm just surmising, right? Maybe hypothesizing right now. It'd be better to use the other porcelains like Emax, for example. It's a good, strong porcelain, but they can chip every now and then, but they more closely will mimic Mother Nature, the hardness of enamel, for example. And on X-ray, you can see through them. So they're quite nice. There's titanium implants and there's zirconia implants. The titanium implants have the metal in them. So from a holistic standpoint, people don't want metal in them. With the whole advent of 5G, and is that going to set us up as sort of an antenna? And does it create weird waves in the body? I'm not an expert at that, but it's something to be, the person can think about. If they want to be metal free, they go to zirconia. But the titanium actually has a give to it. It's like a small flex to it naturally. The jawbone has a little bit of a flexation to it too. So the titanium would be a little bit more biomimetic than zirconium, but the zirconium is going to be more accepted in the holistic fields because it's metal free, essentially. So it's sort of a judgment call. So how do I judge it in my practice? So someone coming in that has great, big, huge jaws, a man that's super strong and clenching down on everything, we're probably going to see about titanium unless he has an objection to any type of metal in his mouth, because at least it's going to give a little bit. Because if you put the zirconia in, on occasion, they'll break the whole implant. So if they still don't want to have metal and they want to do zirconium, we say, well, the risk is you could break that. It's never happened in my hands, but it's in the literature. There's a chance you could break it. If you assume that responsibility, let's go for it. That's okay, but at least they have informed consent on that. Titanium is a beautiful metal because it's extremely inert. And the old Clifford test, Walter Clifford, the innovator of that test, out of south of Denver, Forget the name of that city offhand, but anyway, he's tested over hundreds and hundreds of thousands of patients on dental materials. It's a blood test. It was sort of an antigen antibody test against major different groups. So a person would get this nice booklet of all the different dental materials, and they would say S or NS, so suited or not suited to use that material. And the last time I looked at the whole database was about 10 years ago, but I think it was 93% of people were compatible with titanium on that blood test, and only 87% were compatible with zirconium. So I asked Walter, I said, why are some not compatible? Why are more or less compatible with the zirconium? And he said, well, it's because they use underarm deodorant, which has a zirconium type base in it. So they sensitize their body. So it's showing a sensitivity to that. I said, so in other words, it's not necessarily that it's going to be a systemic activity. He said, I doubt it would be systemic. It might be around the implant itself. You could see some redness, or you could see something, so that it's just a person has to do a little bit of their own research on it and investigation. But personally, I'm good with the zirconia implants now. On my free holistic dental course lecture series, I talk about I favor titanium. That was about 5 years ago. I released those, but now I'm moving more towards the zirconium because of the metal free and the 5G and the controversy around that. Did I answer your question?
You obviously gave me a lot of your thinking on implants, and I appreciate that. So you mentioned that your product for brushing, it doesn't contain fluoride. What are your thoughts on fluoride? Should we be using fluoride?
Well, there's great information in the International Academy of Oral Medicine and Toxicology. So you can go to anybody can go that's watching can go to the IAOMT.org. IAOM is in Mary, T.org. And there's quite a bit of science on fluoride. Fluoride basically being, it's essentially a poison. So it depends on where it's being manufactured, where you get it, how it goes in, is it being ingested, et cetera. So for example, in 2004, I believe it was, the American Dental Association came out and made a statement. Systemic fluoride has been found to have no value or benefit whatsoever for the dentition of people. You go, wow, okay, great. Now what happened after that? Soon after that, LA County, many other counties and municipalities, they got the approval to put fluoride in the water. So it's like hydrofluorosilicate. I don't know. It's sort of a waste product, apparently, that comes from the fertilizer companies and the Alcoa aluminum companies, et cetera. And instead of them having to pay millions and millions to get rid of their waste, they sell it for millions and millions, and it gets put in the water supply. So those aren't good things, right? So even in now, it's recommended that a million parts, a million parts per million, 1 part per million, of fluoride in the water here in LA. They brought it down to, I think, 500,000 parts, 0.5 parts per million or something like that. So they've lessened it instead of 1 part per million. So what they discovered is that people were getting staining from the fluoride. They call it fluorosis. Is too much. It gets taken in systemically internally as the teeth are developing. So they got zebra stripes, so kind of white and dark little lines, and sometimes crisscrosses, et cetera. Very hard to bleach out and whiten out over time. But they weren't causing a greater decrease in tooth decay, is what they discovered. Now, toothpaste has 300 parts per million of fluoride in it when you get it. And there's always a little warning sign. If one of your children swallows a tablespoon, they have to go get their stomach pumped because it can be very, very life-threatening. So that's what we see with that. In the water, it's 1 part per million to a 0.5 part per million. In toothpaste, it's 300 parts per million. Because it, by the way, it does help with tooth decay, and here's how it does. It's essentially a pesticide, because remember I said it's considered a poison. Okay. So it sticks to the teeth it does actually kind of stay around, sticks to the teeth. So it acts as a pesticide. So it keeps some of the bacteria from lodging and getting around the thing. But could we use something less toxic, please, to do the same effect? And we can. It appears that there's another type of sugar called xylitol. And xylitol acts sort of like a Trojan horse. Anybody that's ever watched Troy, and they send in the Trojan horse, and it hides the warriors inside, et cetera. It sneaks them in there. So xylitol tricks the bacteria that cause cavities. Certain strain. I won't go over it because that's a whole biological study that we'll bypass for the moment. But they basically love sugar. So when xylitol gets introduced, they're like, oh, hey guys, look, there's more sugar here. And they begin to gobble it up, and they try to digest it over and over. They can't quite digest it. They can't metabolize it. And they exhaust themselves and they die. So it's known as a Trojan horse, basically, in dentistry, because we're introducing what they think is a sugar, but it's a sugar they can't digest. So they die. So it actually decreases those types of bacteria that can cause cavities. So, for example, in my toothpaste, and there's many more out there now, they have a high percentage of xylitol in them. And the studies are starting to come out showing it rivals those that have the pesticide fluoride in them. I say that I hope I don't frustrate any of the other dentists out there that are really, really fond of the fluoride. But we've been pushed fluoride on us so heavily, they try to stick it in every single dental product out there because it's a marketing gimmick. Oh, it's got fluoride in it, it must be better. And it's just not really the case. And there's better materials. The same way with mercury fillings. There's better materials, stronger, et cetera. And the problem with mercury fillings, besides the mercury in it, is they flex and contract at a violent rate in comparison to the natural tooth. So the founder of modern dentistry, his name is G.V. Black, and he said he had parameters for putting a silver, quote unquote silver, mercury filling in, and they're real skinny, real small little cavities. You never did them big, because even they knew back then, this is around the 1900 or so, they knew if you put the big ones in there, they're going to crack the teeth. Better off putting gold in for those, right? But no, everybody started sticking them bigger and bigger and bigger and bigger, and we see teeth cracking all the time with them because of their flexation problems. So there's just better materials now, and it's the same way with fluoride. There appears to be better materials. And by the way, if I can speak for just a moment on diet when it comes to why are we using fluoride toothpaste in the first place, is to help prevent people from getting cavities, or people that get a lot of cavities, help them from coming back. Okay, so it's a good intention behind the whole thing, right? The problem with a lot of the people that are getting cavities is they're deficient in the fat-soluble vitamins, A, D, E, vitamin K2, and calcium, magnesium, and phosphorus. Some even say amino acid named arginine. So why are they deficient in it? Well, because of different fads, different diets, et cetera. And this is nothing harsh against a vegan lifestyle or anything like that. People have their different reasons for doing things, but the vegan lifestyle can deplete them in some of those vitamins, so they can be more prone to getting tooth decay. Also, the vegan lifestyle, because they're not eating animal products, et cetera, they might be eating more pastas and breads and refined sugars and things like that, but it would still be considered vegan. So if to maintain your teeth and prevent tooth decay, some of the best ways to do it is keep them clean, brush them, floss them. Contrary to what you might hear on the internet, you don't need to floss your teeth. I haven't found that to be true. In fact, we say only floss the teeth you want to keep. That's how much we believe in that one. So, but basically do those things, keep them clean, keep them healthy. And then if you can manage the diet and decrease carbs, refined sugars, et cetera, at least to have them around a meal, versus having them throughout the day. Not only is it healthy for your teeth long term, but it appears to be very healthy for the body and preventing getting into what's called pre-diabetic, being pre-diabetic, and getting and also leading more towards cardiovascular illness and things like that. So little did you know that we're saying, hey, do this to help preserve your teeth. But ultimately we're saying do this because it'll help you stay alive not only longer, but also healthier with less cardiovascular incidents.
Okay. So thank you. So
Sure.
now there's there's two kinds of diets in this, I'm sure you're familiar with the general frame of the Real Truth About Health. And we have a lot of, there's vegan, which is a moral position. And it just means they don't eat animal products and use animals whenever they would it. And then there's whole food plant-based, and they're not really the same thing. They can be, but they can be completely separate. So people who are eating a whole food plant-based, are eating, fruits and vegetables, minimally processed, they're not eating the sugars, they're not really eating, a lot of breads, they're not eating, they're getting very, a lot of nutrients. I find that those people also have issues with the vitamin deficiencies that lead to tooth decay, or are you finding that it's specifically the vegans who are doing it not for health reasons and therefore their diet may be substandard, if you may?
Well, I think they're all, that's the joy we have as humans. We can pick a diet and pick foods that we like to eat, and we have that availability on this planet at this time, which is pretty amazing. So I don't have enough patients that are on the strictly whole food side of the ledger, minimally processed, et cetera, to really be able to give you any type of empirical data from my side, I don't know if they would have a deficiency in any of those other types of fat-soluble vitamins, et cetera. So that would be interesting for me to research and look at. But I will say that anybody I've seen that generally has a high fruit diet, they have to be much more vigilant with keeping their dental care, because they can throw the environment can become much more acidic during the time while they're eating those types of foods. Now, I had one that said, "Oh yeah, I have a high fruit diet. I eat 1 apple a day." I'm like, apple's great. It doesn't have that high glycemic effect. It's not like eating bananas all day long, for example. So I think it probably just depends, like that with that question. It sounds like being whole food. It sounds actually quite yummy to me and sounds pretty good. So
it is.
It is. Yeah, you enjoy it. So, okay, good.
And going back to the fluoride question, you're talking about 1 part per million in the water, and then 300 parts per million in the toothpaste. Are there any systemic? If you eat you said a tablespoon of it, you have to go get your stomach pumped. Is there, over time, being exposed to the fluoride at that level? Is there any systemic problems that we should be concerned about?
Well, I'll actually defer that a little bit to the scientific articles that are on the iomt.org. But from what I understand, they have shown a decrease in developing children that are on the systemic fluoride. Now, I haven't looked at that science, so please, anybody listening to this or watching this, I'm just directing you there because I don't know the accuracy of this. Dr. Robert Kennedy out of San Diego is a really top researcher in that whole field and area. He's retired as a dentist now, but you'll see some of his writings on the IOMT, and also you see toxicologists and other healthcare specialists there. So it's a pretty good interwoven group of people. It's not just a one-sided, one viewpoint thing. So their whole mantra is show me the science, which I love that. So systemically, that's what we see. There may be brittle bone syndrome. We see that happening in China. They drink a lot of tea. The tea is from the water. The water has a lot of fluoride in it. And as the women in particular are getting older, some of the men too, but they start hunching over and be a bent over, and they have very, very brittle bones. So they've shown some skeletal finds of that, full body X-rays of the amount of osteoporosis that happens as a result of that. So I think it's important for people to try to minimize what fluoride they're getting. If they get a fluoride filter for their home, you'll find they're not easy to find, but that just kind of, it's hard to eliminate fluoride now because it's going to be in canned vegetables, to be anything that's rinsed off. So, it's tough. So just try to minimize it as much as you can. On a dental aspect, I think I shared earlier, we get what's called fluorosis. So we can see when there's too much fluoride in the water. It creates that problem. And that's why the municipalities have cut back, I think, to the half part per million, because at 1 part per million, along with toothpaste, they were getting these too much fluorosis in the water. And some of the studies go back to the 1930s and 40s. They basically, some village outside of Denver or something, they showed people that had very little tooth decay, and they said, oh, well, let's find out what it could be. And they saw that the water had a high concentration of fluoride in it. And so that was the science. And so, oh, it must be the fluoride. And, so then without further investigation, apparently it got into the, a little bit the political hands of things. And boy, before you knew it, it's like the waste is getting dumped into the municipalities. And it's just a sad shame, and people go along with it because they don't really know. But, there's interesting stories about fluoride, right? All the way back to, is it that damaging or not damaging? What can a person expect from it? All the way back to Nazi days in Germany. Some interesting things about putting fluoride in the water there. I don't know. I like conspiracy stuff, but I like the science too. So I would say try to get fluoride filters in your homes and keep as much of the fluoride out of your system as you can, because it apparently has absolutely zero systemic benefit, and it's considered a poison. So why ingest it?
Okay, I'm going to ask you about gum health. I don't know if there's anything specific to biomimetic dentistry with regard to gum health, but how do we keep our gums healthy and avoid pockets within our gums and gingivitis, those types of issues?
Sure. Well, gum disease also, there's obviously some genetic predisposition. So if mom and dad have gum loss, gum disease, et cetera, the kids generally get it too, a little easier. But a person has to be vigilant. So, for example, a dentist could grow up in one of those families, and because that he or she is vigilant, they don't get gum disease, but mom and dad had it. So there's something to be said with being vigilant and being able to take care of things. So what do we want to do? We want to get rid of the harmful causing bacteria if they accumulate and build up. How do we do that? Using different medicaments. Natural is best, in my opinion, that can eradicate and kill some of the harmful bacteria on a daily basis. Brushing can help and keep things clean. Again, on my freeholisticdentalcourse.com, I show proper brushing. It's amazing how many people don't brush proper. Because they get a little bit of recession, someone teaches them or something to just brush up away from the gum and very gentle. It's like, wow. The gums are meant to be stimulated by the toothbrush. By stimulating them, you're flushing the blood flow through it, and you're keeping them strong and healthy. So same way with flossing. The flossing can be where you're going up and down like a C around the tooth. So you're cleaning the sides. So you're cleaning, but you're also mostly breaking up bacteria. So those bacteria form this microbiome. It takes 24 hours for them to form a village. And the floss comes through, breaks them apart, and they go into apathy over the whole thing, and they're like, what do we do now? And it's like Groundhog Day for them. They're like, well, let's come back together again. Let's form a group. And then the floss comes through again. So it's like it's nice dance of keeping a balance there, because without a lot of these bacteria, even some of the harmful ones, we don't want a lot, but even some of the harmful ones apparently detoxify things from our bodies. And even some that are more on the benign side, streptococcus and things like that, if they go way out of kilter, you can get infections and things like that. But they're also innately involved in um, uh, creating some of the nitric oxide in the body. So they take nitrates and they convert them to nitric oxide. And so that's what's keeping the blood vessels flexible and moving. So if you just try to kill everything and eradicate everything, you'll get some health, but long term, you can get overgrowth of other types of bacteria. Or if you're using a chlorhexidine or a medicated mouthwash, the number one side effect is hypertension. Wow, what a weird. Now, no, most people don't know that because it's so disconnected. You're rinsing with the mouthwash here. Bob's got hypertension. Oh, yeah, he just developed it. What's going on? Well, for the last 3 years, he's been using a certain type of mouthwash, increases the risk of that because the nitric oxide levels have gone down in the body. So all these things are connected, and because we become so specialized, we don't join the dots sometimes, right? So going back to your question, what does a person do? Brushing properly, flossing properly, right? Using natural products that can help eradicate the accumulation of harmful bacteria and really add back a good probiotic for the ear, nose, throat, and mouth. If you're not adding that back, then there's a chance that your own genome is going to just quickly go back to what you've been fighting. This way you can change it. And the beauty of changing it with these natural beneficial bacteria is if you go, yeah, I don't really like that, I want to change, within 3 weeks, it goes back. So it's not a Frankenstein's monster where we're changing something forever. We're just basically trying to drown out some of the harmful bacteria by killing them, yes, not killing the good ones, and then putting more of the good ones back in. There's only so much food supply in there, and then the good ones start drowning out. Now, if a person has gingivitis and no pockets, which a lot of people have, then doing just that will clear up their gingivitis. But if they have gingivitis and it's getting into the bone, then the body has gone into an autoimmune type of response. So the body is basically seeing some of these things as they're seeing inflammation happening. So rather than cleaning up the inflammatory area, the body tells itself, we need more blood vessels in there to bring more white blood cells and the big gobblers, the macrophages, to take those bad bacteria out. Well, it doesn't know how to shut down. It starts attacking its own bone to get bone out of the way to send blood vessels there. And we begin to see bone loss. So what do we do with that? Let's get the bacteria balanced, turn that weird autoimmune response off, and we should bring about some health. And working with a good hygienist always does wonders. There's an interesting concept. I think it's in Finland and I think in the Netherlands, but Finland, I think for sure, because they have socialized dentistry. My understanding is they go and people generally get their teeth cleaned every 6 weeks to 2 months. And they have virtually no major troubles with their teeth because of that, because they're there all the time. So they're staying ahead of it before it becomes a problem. And last, I could tell you, my understanding in the United States, 50% of people don't go to a dentist regularly. They only go when there's an emergency, if at all. So it seems like they're maybe saving some money, but it's also good to get in. If you can find someone that's holistic, maybe biomimetic as a combination, get things checked, looked at, and just try to do things as minimal as possible, but keep that hygiene under control, because the healthier your gums are, the healthier your cardiovascular system, your heart, et cetera, is going to be. The people that have severe gum disease, they're at a multiple higher risk of getting coronary artery disease or having a stroke or something like that. For some reason, they have so much inflammation from the mouth, and it's getting into the bloodstream, and it's going in, and they can find it in people that have had, sadly passed away. They can find some of these walled off similar bacteria that are in the bloodstream or in the area of the clot or in the heart attack area. And so if we can reduce that, then we can bring about a greater quality of life.
Great. And your dentist, your toothpaste has that ability to balance out the bacteria.
The toothpaste can help to bring health and healing to the gums, and it's got a remineralizing aspect for the teeth. So because it's glycerin free, it creates a super clean effect. Glycerin is in almost all toothpaste, and the glycerin super coats the teeth, and glycerin is negative charge. Plaque is apparently positive charge. So you're brushing with most toothpaste, and within 10 or 15 minutes, your teeth feel dirty. Anybody I'd be talking about, yeah, they do. It's because the glycerin, you need to swish like 16, 18 times, et cetera, to get that fully off. So it can slow down the remineralization process, everything. So mine has no glycerin in it, no sodium lauryl sulfate. It's gentle foaming with natural coconut agents to help with the foaming. And it'll help remineralize the teeth because we took a product called hydroxyapatite. Hydroxyapatite is basically essentially the mineral content of bone and tooth material. And it was nanoparticleized. And the importance of it being nanoparticleized is when you put it in a toothpaste, when you brush it on the toothpaste, it'll go into those dental tubules, not just around them, but actually go inside. They're small enough to fit in the circumference. And so theoretically, it should decrease sensitivity, make the teeth feel cleaner, et cetera. And that's what we're getting, the reports that we're getting and the studies are showing that it does actually occlude those dental tubules. So you want that with the toothpaste. With the essential oil that we have, it kills 8 of the major inflammatory pathogenic bacteria that are attributed to gingivitis and gum disease, and also to fungus, candida. So in fact, the researchers that did the study, they were blown away. It blew away the control drug. It was much more potent than the control drug for candida or fungus of the mouth. It's a specific certain strain. So then after you've cleaned everything up, now you've got a nice, the slate is clean, it's ready to go. Then you put a couple of the tablets of the probiotic in and let them just seed and go through and keep laying in their strong foundation. And it's interesting, the reports we get mostly from women, I don't know why, genetically or whatever, but many of the women will say, taking the probiotics when I wake up in the morning, my teeth feel so clean. I don't even feel like brushing my teeth. And I'm like, okay, well, you still need to brush your teeth, but the men don't notice that so much. But all in all these things, the breath gets fresher and healthier. The little essential oil, we could call it ready to be kissed, because you put a little drop on your finger, you rub it in, and I mean, the spouse is right in, like, oh, this changed our lives, we're, more intimate, et cetera, right? And go, wow, okay, that wasn't my main purpose, but okay. It's just a sign of robust health would be naturally fresh breath, unless someone's eating garlic all day long. There's nothing you could do if someone's eating garlic all day long, okay? But maybe they'll live to be 110. They might live alone, but it's okay. They're going to live to be 110. So that's the 3-pronged way to help do those things. So, and for anybody out there, there are some toothpastes that are saying they have probiotics built in the toothpaste. They don't survive is the problem. I did that research for about 7 or 8 years. They just die. And then they say, well, we'll put spores in there. It's like, I don't know. I don't know that the spore is going to nicely change into these healthy type of, I don't know what they're going to do, but I know what these bacteria do because there's huge studies on all this stuff now. So there's a lot of stuff out there. So I'm just trying to guide people. Great Oral Health has very, very safe products, but that's not my purpose really for being here. It's just to let people know, read the ingredients, read what's there. If you can get a toothpaste without glycerin, you want one without glycerin, it's going to be much cleaner. You want to also make sure it's not overly abrasive. There's a certain range from 0 to 250. If you stay in the middle there somewhere, it's really, really good because it'll clean things, but not strip away the enamel. And then if you can get something that can help the body remineralize the enamel every time you're brushing, well, then you've hit the holy grail, because right now we don't know how to turn the enamel enzymes back on to regrow enamel. They're working on it, University of Washington. They're going through FDA trials and studies, but we're a long way away from it. But it would be cool if they can do that. And then we've really got a solution. If someone eroded their enamel away, could we put a solution on there and let it grow so many nanometers per day? And then we would know after 2 weeks we have so much laid down. So those things that's the future of dentistry and the future of oral care.
Great. I'd like to open up questions to the audience, if I may. We have a number of people with their hands raised. So I just want to go over just a couple of things. So we don't take questions directly from the chat. Instead, we ask everyone to raise their hands. If you're not sure how to do this, you'll go to the button second from the right at the bottom of the Zoom. It's called Reactions. You're going to click on that, and then you'll select Raise Hand from the pop-up window. When I call on you, I will unmute you and prompt you to state where you're from and to ask your question. And please keep your questions brief and on topic. And with that said, we are going to go to Rochelle. Rochelle, please state where you're from and ask your question.
Hi, can you hear me?
Yes, we can.
Okay.
Hi, Rochelle.
Hi, Dr. O'Malley. So I've been in the past to biomimetic dentists, and I was wondering if there's a criteria to be a biomimetic dentist, because the dentist I went to was like, not to quote somebody I don't like, but it was like drill, baby, drill. And he, there was nothing biomimetic about drilling down teeth and then crowning them, because I had fillings in those teeth, and, the fillings had to be replaced. So I was wondering the criteria. The dentist I'm going to currently, I absolutely love. I think he does phenomenal work, but he does core buildup. Is that the same thing as, as biomimetic dentistry?
I would say it's, Rochelle, it's great questions. It's hard to tell what they're actually doing there. I've lost my picture here somehow, so I'm going to try to get back.
I can see you.
You can see me?
Yeah.
Just, I don't know what kind of computer on, but you can just look for the Zoom in the taskbar.
Yes.
On that.
We back?
Yep. Okay. Did
good.
you have anything else?
Yeah, I heard the question. Thank you for that question. It's hard to tell. If you go online, go to the aobdm.org website, and you'll see what we consider to be some of the criteria and some of the training and some of the courses, some of the sponsors, mentors, etc. You could also see if the dentists have signed up in there, because if they do, they make a pledge that to the best of their ability, they'll apply what they've learned in biomimetic dental seminars. It's the best we can do, because we're not a policing type agency, but we put that together to try to help with it. Now, in my practice, you'll see I do core buildup on almost everything. So core buildup's just it's a computer generated procedure that has a dental code attached to it. So if a person's using insurance and things like that, they can attach it and send it in, and they may get some payback from that from the insurance company. The core buildup is just a fancy way of saying we build the tooth back up in layers underneath if we're putting an onlay on it or something else on it. Now, even when I'm doing a large, we call it a direct restoration, meaning I'm directly fixing it that day. I'm not sending it to the lab. Many times I also put a core buildup. That's just indicative of me taking the time to build things in layers. And then I do the final biofill on top of that, which is also in layers. So it's just a way for me to be compensated for the excess time. Rachel, if you gave me a little bit more information on that, I could probably answer the question better. So he's doing a core buildup, and then what? A
core buildup and then a crown.
Okay, is it a tooth you had a crown on before?
There's a lot of teeth. It's a tooth I had temporary crowns on, and the previous biomimetic dentist just drilled it down and gave me, temporary crowns. And this dentist cleaned it all up and he's been doing core buildups on those teeth, but he eventually
That's
plans
good.
on crowning it.
It sounds like you're on the right track. So when he's doing the core buildups, are they root canal teeth already?
Some are, some aren't.
So the procedure is a little different on the root canal teeth, on vital teeth, living teeth. You would be able to tell it's not, they won't take a material and kind of place it and then they're done with that buildup. They have to do it in layers.
Right.
Are you aware? Is he doing that? He or she doing that?
Yeah, I mean, the dentist I'm going to has a fabulous reputation, and I feel really, really confident with him. So I trust him, but my question was really about the criteria, because I've been to a biomimetic dentist and it didn't mean anything because he wasn't what he said.
Yeah, I mean, it'd be, someone saying they're probably, a foot specialist and, they took one seminar on something about feet and they didn't even apply what they learned. And, so not to belittle this whole situation, but I think that's the hard part for people that are searching around. So you can look at the credentialing and say, where did you do your training? Who did you study with? And then you can look up those people, because you'll find out there's only a handful of people, maybe 15 or so worldwide, that are really known for training and teaching biomimetic dentistry. And then, it doesn't always mean that they're going to do it. Once they learn it, doesn't mean they're going to do it exactly that way, because I know some quote unquote biomimetic dentists and I'm just going, wait a minute, they're not even doing this buildup. They're not doing this. What's happening there? Well, they might be at the infancy of their learning curve. So I give them the benefit of the doubt, but that's one way you can research it. Just ask where they got their training and how long have they been doing it. You could even say, how has it changed your practice?
Thank you so much.
They'll come alive with that question. Okay.
Thank you so much for your answer.
You're welcome. Thank you, Rachel.
Great. Our next question is going to be coming from David. David, please state where you're from and ask your question.
Hi, Doctor. I'm David from Massachusetts. I have
Hi,
two
David.
questions. Hi. Thank you very much for your great lightning presentation. I have two questions, please. One, I have three tooth extracted because they had root canal. And by the time that I wanted to do zirconia implant, they said that there is not enough bone. So they wanted to do bone grafting for me that made of cow bone. And I was a little bit suspected that maybe there is better alternative than putting in my body something that made of cow. I wanted to understand what is your opinion on this. And my second question is regarding if you're familiar with photoelectric ionic toothbrush that should kill the bacteria in the mouth, and what you're thinking about this. Thank you.
Sure. Thanks for your question. I appreciate that, David. As far as the bone grafting, you just want to see someone that has a lot of good statistics and history with bone grafting. There's a lot of different materials out there. Sadly, I'm just not an expert to tell you about that, but you could reach out. I'll give you the number to someone out here that you might be able to send an email to them, to their office.
Yeah.
If you bear with me, I'm just looking it up right now. Yes, there's a number you can call. It's a periodontist down in Southern California, but their number is 310-826-8242. And they'll give you the website. You could probably even do the research on there and see. But those are good things. I mean, you want to make sure what kind of materials they're using. A lot of these bone grafting materials, they're meant to be like a scaffold to allow the cellular matrix to build up over and rebuild the bone. And some is actually like a block of bone in there. So, your question is well thought out. I think if you call that number, they'll give you the information you need, David. Okay.
310-826.
Yeah. Go ahead.
310-826-8242, correct?
Yes,
Okay.
got it. And then the photoelectric ionic tooth cleaners, spin brushes, etc. I'm in some research with that now, even with my company, Great Oral Health. I'm looking at what are truly ones that actually do what they say they do and no hype behind it. Some of these are marketing hypes. So I don't really know. I do know that if you brush with a glycerin-free toothpaste, you'll decrease the photoelectric charge to the plaque that's always harboring around. So, you won't create a negative charge right off the bat. So there may be some science to it. I'd have to look at the science to see. I don't think it's going to create any harm is the main thing.
Yeah. Thank you so much, Doctor.
You're welcome. Thank you for your question.
Okay, our next question is coming from another David. David, please state where you're from and ask your question.
Yes, so my name is David. I'm from the Washington, D.C. area. And I was first curious to know, instead of implants, what do you think of flippers or bridges, flippers being false teeth where you remove them? And the other is, as far as dental material, do you have a general recommendation of what dental material you would use for fillings, or do you just use the Clifford test and ask your patients to first do that and then determine the dental material? But generally speaking, which material do you think is a good one to use for fillings?
Okay, so going back to the first one on the flippers, you can also test for those materials too on the Clifford test. There's another test called Biocomp. I'm not a big fan of the Biocomp because of their computer model sometimes ends up negating some really good materials. And it's just because of their computer model. And so you end up sometimes using inferior materials, but the Clifford test is good. It's on pause for about a month or so. Another company bought it and they're working their way through a few of the challenges with it. So flippers are quite a fine option, I think, short term until a person decides if they want to do any type of dental implants, plan it out. They can see, gosh, if they love the flipper and they're able to function with it and it's just they're happy as can be, you can continue with it. Now, the challenge with flippers where there's missing teeth, et cetera, it depends on how big the space is. Are there teeth supporting it on either side, or are there no teeth in the back and it's a big flipper? There's a lot of things to look at prosthetically, because if you're putting a flipper in where let's say there's no teeth in the back, over time, it'll push on the gum and that bone, and it'll cause the bone to sort of melt away over time. So, and then it can torque on the good teeth. So those things have to be looked at long-term. Short-term, I think it's a great and viable option. Now, as far as the dental materials, I use a material called APX and Majesty Flow. Those are my main go-to. And then adhesive called OptiBond. It's a gold standard adhesive. Has some of the highest, what we call bond strength. So first we clear out the decay, and then we lay a bond layer in there, adhesive layer in there. And if that's not real strong, no matter what we do, even if we build in layers, it's going to fail. So this is a really, really good material, OptiBond, and it tests generally in the 98th percentile of the Clifford tests. So in my practice, I might get 1 or 2 patients in a month or every 2 months or so that test negative to it. And then there's some other alternatives that we can play around with.
What do you think of the bridge, though? What do you think of the bridge?
A fixed bridge?
Yeah, instead of using an implant, many practitioners suggest doing a bridge, I guess, where it's something that you go between 2 teeth and you somehow hook it together. I'm not sure how it works.
It's good as long as the span is not too long. If the span is too long, you can put a lot of pressure on those anchoring teeth. But that's what we did. We've done for 100 years. We've been doing those, and they can actually have good success. The problem is the teeth that you attach to, if it's a long span, you have to grind them down as if you're doing a crown.
Oh.
And they all have to draw properly so that that bridge has to slide over both teeth at the same time when you cement it. in place. So you have to end up whittling down those teeth a bit. Now, that's one traditional way of doing a bridge. There's another type of bridge, which is a bonded bridge, and you can do it in the front. If you go on my videos, you'll see I even have a bonded bridge right here in the front. This tooth is missing, and I bonded it on the back side. It's a certain type of material, which is very holistic. It bonds on the back side. It's anchored in, and it probably will never come out because we have 14-year studies with those. And I can floss. It doesn't even have to connect all the way to the other tooth. Well, we can do that in the front, but in the back, we need a stronger material. But sometimes we can bond those to the adjacent teeth in the back. The problem is they're weaker. If they break, then you just have to pay for another one. But if you're ultimately not wanting to cut down your teeth, just ask for a bonded bridge and tell them you'll assume the risk, and you should be good to go if there's a tooth on either side.
Thank you for that. Our next question is coming from Ivan. Please state where you're from and ask your question.
Hello, I am Ivan from Mexico, and I have some brief questions to Dr. O'Malley and a recommendation. Is it okay?
Yes. Fantastic.
Okay. Hello, Dr. O'Malley. Are you planning to write a book about your work? Does xylitol have the same effect as a Trojan horse with gut bacteria? Have you tested the bioavailability of your products once they are X-rayed when they cross the border? Do you have a way to clean or detox the plastics inside the mouth and the body that mimics estrogens? Do you take care of the multiple effects of these and other materials used by traditional dentistry in your clients? And the recommendation, do you beam light, ultrasounds, and electrons at the same time to cure the tooth or the cavitation? If you don't, you have to check the beamer that dissolves cavitation in the bones, invented by Dr. Andrew Hage. His site is cellsonic-medical.com. If you beam the infections with his invention, you can kill selectively all the bacteria in minutes, even inside the microtubules without tissue damage. That's all.
Wow, that's fantastic. I'm not familiar with that. I love that. What is the email of the Sonic Beamer?
I lost his email, but the site is cellsonic-medical.com. And the doctor is Dr. Andrew Hage, Hague. He has been severely censored by his invention. It beams the three kind of rays inside the bone even. Light in the form of profound laser, ultrasounds, and electrons. It's the same principle as the lithotripter of the stones in the body.
It makes sense. I love it. I can't comment on that one. Wow, you have a lot of questions here. So
yeah, I'm sorry. That's why I asked you.
Answer some of these. Sure.
You want to pick one or two of them?
Am I going to be writing a book in the future? Yes, I will be. It'll be in the next 3 years. I'll be putting a book out of some of my adventures. I'm going to try to make it enjoyable, fun, and educational. Right now, I just have a standard book that I wrote with my business partner, Tom Sirocco, on hygiene care and some of the history of hygiene and dentistry. It's on the website, thegreatoralhealth.com website. You can get one for free. I think the exchange is that you give an email and you get the free ebook, which is some 140 pages of good information. Then your second question was something about, is silica as good as something with a xylitol? Did I get that right? Because it broke up a little bit.
If the xylitol is a Trojan horse inside the body with the gut bacteria, the same way it is with the oral bacteria. If it hurts the gut microbiome, our microbiome eats it, thinking it's some kind of nutrient, and it's killed by it.
Yeah, my understanding is in the gut microbiome. Well, anyway, if you take too much xylitol, it can upset some dysbiosis and diarrhea and things like that. So what I have in my product, of course, the toothpaste, you don't need to ingest the toothpaste at all. But what I know theoretically is in the oral cavity, the bacteria, basically, they just run out of energy trying to digest it. So they die naturally, allowing the other beneficial bacteria to come in, because we don't want to have the main strain is Streptococcus mutans and Sobrinus. We don't want to have a preponderance of those in the oral cavity. If so, throw a little bit of carbohydrates and a little bit of refined sugar, fruit juices, etc., and they're off to the races. So this kind of calms that down and slows it down, and especially for cavity-prone patients. So I hope that's answering your question somewhat. I haven't heard of any I haven't heard of any stomach upset or anything with the toothpaste products. Secondly, let's see, your next one.
The plastics of the traditional materials, do you have a way to clean them from the body? Because they mimic estrogens.
The only way I know is an old Indian kind of thing, and it's a sweat out sauna. Might be from infrared sauna. Just sauna sweat out can get some plastics out, from what I understand. Now, I haven't done the studies on it or the research on it, but with the dental materials now, you can get fully BPA free. I think there's another BP in there. They can be really, really more on the holistic side. The best is not to get any dentistry done at all, prevent it all from happening. But in our world, at least we're fortunate enough we can save teeth, whereas before people actually died or wish they had died from tooth infections because they were so severe. So at least we don't have to suffer that. But plastics, I think, is sauna and sweat out. That's the only way I've heard of how they can be potentially eliminated. Okay.
Yep.
Then
just have 1 more minute left, just so you know.
Okay. What else? What was your next question that you had?
About the bioavailability of your products once they are X-rayed when they cross the border, because I live in Mexico.
Okay, so once they're X-rayed, so what might happen to the products? Would the irradiation wipe out the bacteria, wipe out the beneficial bacteria? You know, I don't know. It's a darn good question. I'd have to find out. I don't think it'll harm the toothpaste or the essential oil. It might make the probiotics less viable. But I honestly, I don't know.
All right.
I'll tell you, it's easy to find out. You use it, and if you feel a beneficial effect, you would just continue using it, because if it irradiates and wipes out some of those bacteria, you're still going to get enough that it should be beneficial. I don't think it'll transfer the radiation effect to the body, hopefully.
Right. Thank you so much, Doctor, for your, for all of the answers. There was extremely informative. So thank you. Please open up or unmute the audience. And
thank you so much. It was really great. Very informative.
tip about your book was